Greetings and welcome to CIBER Focus, your source for international business information. My name is Jessie Mroz and today I'm joined by Peter Park. A native Hoosier, Peter is currently a partner at Mindflow Associates, which is a consulting firm that offers information technology consulting services specific to healthcare with a focus on emerging markets such as Kenya, Ghana, India, and Nicaragua. He is also a founder and president of Village Labs, a consulting firm with a focus on energy and healthcare, both of which are housed in Kenya. Welcome, Peter.
Thanks.
First of all, could you tell us a little bit about the work of Mindflow Associates and Village Labs and elaborate a little bit more on what you do in both of those organizations?
Sure. Yeah, I would say just in some, both of them are very much focused on healthcare delivery in emerging markets, in frontier markets. So I'm based in Kenya, and we work basically on primarily mobile technology solutions and information management solutions that can help healthcare providers and patients access better care.
What's it like being an entrepreneur in the developing world? What types of unique challenges does it pose?
Well, first off, I'd say that being an entrepreneur in an environment like Kenya is it's exciting. There's opportunities everywhere, and it's one of the first things I first noticed when I first moved to Kenya was how many different opportunities there are. So, I would say as an entrepreneur, first of all, it's a phenomenal place to think about idea creation and how to create value for society in places that need a lot of new products and services. But that doesn't come without its challenges. I think there's the business environment in a lot of these settings is often pretty kind of a labyrinth to be able to navigate. So I think it always helps to have a good local knowledge or local partners to be thinking through some of these challenges. But I think it poses a different set of challenges, but they're if you can find a way to crack through them, then I think you can really have a pretty good experience as an entrepreneur trying to build a business in a place like East Africa, where I'm based.
Why did you choose to focus your work in Kenya in particular?
Well, I moved out there for the first time in 2003. This was a little bit after undergrad. I had spent some time in Ethiopia and was considering medical school, actually. So I got involved with a program called AMPATH at Indiana University at the med school, and I had an opportunity to help work on some of the new programs that were going on out in Eldoret, Kenya. So that's really, it was really an opportunity to be able to be involved in international health. That brought me out there. From there, I saw a lot of different kind of management, kind of needs for management training, which brought me over to business school, and then seeing all the different entrepreneurial opportunities kind of tied that together into kind of this next iteration, living back in Kenya again, trying to do entrepreneurial ventures. So.
Could you elaborate a little bit more on the work of AMPATH?
Yeah, sure. So AMPATH stands for the Academic Model Providing Access to Healthcare. It's a program that has been in place since 2001, I want to say 2000, and is the flagship program of Indiana University Medical School's international efforts in Eldoret, Kenya. So IU, back in 1989-1990, helped start a partnership that was primarily focused on medical exchange, faculty exchange, student exchange, and from there had basically been building a strong relationship with Moi University in Eldoret, Kenya, as well as other U.S. partners that engage in kind of medical exchange and research. So 2000, when 2000 rolled around, the HIV crisis had really taken a massive toll on not just the communities, but I mean the doctors themselves were dying of HIV or of AIDS, and at that point, IU Medical School as well as the other consortium partners were basically, we don't have anything to do here if we're not going to be tackling HIV front and center. So that's where AMPATH really started from. So it started as an HIV control program. That all the university partners, led by Indiana University in the U.S., with Moi Teaching and Referral Hospital, which is the one of the two national referral hospitals in Kenya, and Moi University's medical school, got banded together to start working as one of the early pioneers, really, in actively managing HIV and AIDS in Kenya. So it's the largest HIV control program in the country now, and is the largest U.S. government-funded mission in the country as well. And from at this point is providing HIV care services to about 150,000 patients throughout Western Kenya, over about 59 different satellite clinics and sites, and yeah, it's really one of those kind of very notable, I think, achievements that IU can be really proud of.
Could you talk about some of the work that you specifically do with AMPATH?
Yeah, sure. So we're working a lot on sustainability-related questions right now with AMPATH. They've been, like I mentioned, funded by PEPFAR, which is former President Bush's presidency emergency plan for AIDS relief, to provide basically an emergency response through HIV medications to kind of stem the global crisis. So they are the largest funder for AMPATH right now. And in a 5-year period, basically that grant effectively runs out. There's some uncertainty about where is it going to be 5 years down the road. And so I'm working with AMPATH leadership on what kind of strategies can we have in place to be able to sustain the clinical program in light of kind of these funding uncertainties. So I know that's a really vague, broad kind of goal, but that is the goal, and we're still working through what the appropriate strategies are going to be. Healthcare insurance and provision of insurance to be able to help pay for some of the services is one of the things that we're looking at. But we also have a lot of cost side, provider-driven initiatives to be able to see more patients at higher quality at a lower cost per patient, and I think it's going to be a combination of both revenue and cost side strategies that are going to be able to get us where we need to go in the next 5 years.
Could you elaborate just a little bit on some of the funding projects you're thinking about?
Regarding the
For the AMPATH sustainability.
Sure. So it's still relatively early on, but we're looking at how can a community health insurance product help induce savings, be able to sustain some of the services, and be able to create community ownership over the services that they're getting. So nothing is really. We're going to be launching probably within the next few months, and we're still in program design phase. But there we see some opportunities with using some proven technologies that have been able to disrupt financial services in developing countries, such as M-Pesa, which is a Safaricom-led initiative in Kenya, a very successful text message-based money transfer program, basically. Using, let's say, a technology base like that with a community-owned and community social networked initiative, let's say through church groups or microfinance groups or informal savings and loan associations, and driving those kind of two pieces together to have members in the community pool their resources to be able to take care of themselves and their neighbors through health insurance. So it's a big challenge. Health insurance penetration, I think, for, let's say, the private market, where they're voluntarily paying for their own health insurance, is only about 1.8% of the entire country. But so it's a huge unpenetrated market. And if it were easy to do, I'm sure it would already be done. But that still represents a very important opportunity. And I think with AMPATH now providing care for so many people and having a network set of healthcare facilities throughout Western Kenya, our idea is that we think we can get a health insurance product paired with this to kind of make it like a Kaiser Permanente or kind of a managed care organization that has both provider and payer functions, really for the first time in Kenya at the scale and at the penetration into the community that we're aware of.
So what sparked your interest in working in these emerging markets?
Well, out of undergrad, I wanted to, I don't know, I mean, I've just always been interested in international development and international health in particular. And my first opportunity to go abroad in a developing country context was in Ethiopia, my senior year in college. It sparked a real interest in, just kind of what I wanted to do with my life. So, I mean, I can't say much more than I think there's a need. It's fun. There's no 2 days that are the same. And from an entrepreneurial perspective, there's so many different ways to do something better. I feel like that's where entrepreneurs kind of come out of, right? Is I think I can do something better than what's out there right now, and that's certainly here in the U.S. and anywhere. There's always those opportunities, but I think maybe just being in a different environment, having in Ethiopia and then in Kenya, just kind of sparked that interest. It's just intellectually stimulating, and the fact that no 2 days are the same always just kind of makes for a pretty interesting time. So.
Great. Well, I think that's all the time that we have. Thank you so much for joining us.
No problem.
And thank you for joining us on the latest issue of Cyber Focus. If you have any questions or suggestions, please do not hesitate to contact us at ciber@indiana.edu. Thank you.